So it's fantastic to be here. Thank you all for joining. My name's Chris Weatherburn. I'm a GP, portfolio GP, work in Dundee, also with NSS. This presentation has not been endorsed by Dundee Health and Social Care Partnership, NHS Tayside, or NSS, okay? Yeah, they're laughing. So, digital healthcare leadership, that's a lot. Each of those words is a whole career for somebody. We've got 45 minutes. I'm aiming for this to be an interactive workshop. This is what we're going to cover: failure, change, and also leadership styles. I'm hoping that you'll all get the feel for something to take home. It may be something resonates with one of you. Somebody else may like the sound of something. So we'll start off with a bit about failure. This is things that people don't like to talk about, particularly in public workshops. So why do digital transformations fail? Now that's a question for all of you. And if you want, you can get out your smartphone and use that code there that's really small, 18539265, and go into menti.com and put a few things. Equally, you don't have to. There's only one Menti, and I don't want you to get any FOMO when it's gone past. But look, we're in Scotland today. I'm English as well as Scottish. I'm British from Berwick-upon-Tweed. But it's not good to share our own failures. So I thought, how about somebody who's done a systematic review on why things fail in England? Yeah, seems okay. So there's a few reasons why things actually fail. But equally, if I just read a little bit about from the results from this systematic review, it said that there's, the words are really long, by the way. I've chosen the wrong thing. There's an emergent NHS IT strategy focusing progressively on technical and data standards. We see that we've got our own standards that we're keen to follow. But there's also difficulties with connectivity. Again, you're thinking something familiar here. Applications and consolidation. And we just heard a lot about applications there and the promises that these could help with NHS Lancashire. Now, at the end of the day, though, NHS is also described as a complex, hierarchical, multi-organizational thing, a beast that needs restructuring. And I can't put any more complicated words there. But it's research. So what does it end in? Anybody want to guess? Well, the conclusion is the alignment between incremental health IT strategy and dynamic structure is an under-researched area. And we can look across overseas to HBR, Harvard Business Review. This is an old one. They've updated their logo. The new logo is still equally dry. You'll see that later on. Although you won't see any graphs, really, any bar charts. For once, I've managed to do a presentation with no bar graphs. So, HBR, lead and change, why things fail. Well, here are the actual answers. Now, there's 8 of them. You can vaguely make them out. But we're lucky because we've already got leaders who are establishing urgency. And if you think about it, we've got powerful people leading teams. And then you think about a vision. Lack in vision. This is a common thing. This is one of the reasons why things fail. Now, let's see if we can see about our Mentimeter. Its technology, it obviously will fail, and it has failed. So I'll pull that up at the end and perhaps share that with Alex. But, you know, that's life. Things fail, that's why. Depends who you've got in. So these are the 8 ways to actually transform from the same chap John Cotter, who's a well-renowned speaker. This is back in 1995. So you can see how he's done it. 8 reasons why things fail. Well, here's 8 ways to have a good solution so things don't fail. And a few of them resonated with me. But I do think that the main one is about the clear vision. That's something that we can fail with, or we can think, well, we need the clear vision. Or is this that it's all boring and just in black and white? So look, he's made a new book and it's in color. Now still, I think the key bit of this is that there's useful interactions between the networks and the hierarchy. And this is a concept which is about teamwork. You'd have one side that almost is the business as usual side, ticking things over. And the other side, I'm not looking on one side or the other on purpose, by the way, but the other side, this is where you're trying new things. And in the middle of these two networks is the leadership team. And I believe that that's one of the ways that things can improve. So it's known as a dual operating system. But I've said already, vision. Vision is good. But is it enough? Vision isn't anything unless it inspires action. And what we have to think about is who we wish to inspire action from. Because I could spend all year speaking with one single person who, for example, their views, it's really good to have their own viewpoint, that's what makes the world special. But if they're an anti-vaxxer and I'm pro-vaccine, it's not going to go anywhere. I've tried this before, I've failed, I'm not going to do that. But if we think about leading digital healthcare, we should be thinking about who the key people are to influence. And a lot of these would be the early adopters and innovators that I'm probably blocking just here. And, the other thing is a key is about stories. Now, a story isn't the same as a metaphor or an analogy, because these metaphors just give the audience something to think about. Oh, that's an easy way to compare something. But a story is the way to potentially inspire action with data. And I said there weren't many graphs here. I made this a while ago, so I'll see if I was misleading you or not. I don't believe there are many graphs, but I've got a few stories. And I believe that what it takes for an audience, and an audience doesn't have to be a kind of lots of people sitting on chairs. What it takes to move your audience is a story. And that takes effective communication, and people have to think about effective communication. Everybody has different styles, but is the communication goal-orientated? What are we trying to change? And which stakeholders should we try to change? So here's a bit about IT, digital. Now, on the left, there is a lovely quote: truly interoperable, afford patients with more access to control over their healthcare data. That's from America, and they've spent a lot of money, billions of dollars. The thing is, it doesn't really sell, does it? Somebody spends lots of money. I don't know what $1 billion is. I can't visualize it. Whereas what I can visualize is the story on the right side of the screen. And that is about vaccinations, health, and one individual receiving one of the first vaccinations in Scotland. So we're thinking a bit about this in terms of redesign. And this is about going back to the digital bit on the left here. How would we redesign things? We could learn from businesses, okay? And this is non-healthcare business. So if anybody's been fortunate enough to purchase a Domino's lately, there are other providers, but you see there's this little wheel that appears. Your pizza is being prepared. And you think, why did they do this? Is this just to amuse a child? Well, it was to stop people phoning, stopping the person who's preparing the pizza to say, yeah, it'll be ready in 10 minutes. Whereas we also think a bit about Uber, for example. You've seen the little car appearing. Again, other providers are available. It depends if you live in Dundee. Uber isn't available, but it's a lovely place to live and work if anybody's interested. But that car was visible not just because we like to see something on a map and then, wow, they exist in a Toyota Prius, but it's because they look at metrics and they've seen that their drop rate, their cancellation rate did reduce. So now we think, what happens in healthcare? If I refer somebody for an echo, genuinely what happens? Well, at some point they get the echo and they live happily ever after, or not, but the fact is it's a wait, right? They're waiting for this echo. And they say, okay, I'm waiting now over a year for an echo. Who do I call? And they call the GP, right? Now, we had last year Dougie Elder, one of his visions, and I'm sure it will come out, is that people could then access their own data to say, okay, when will my echo come? I don't want to phone the GP, I want to check. Okay, I'm on a waiting list. And that actually could add a safety issue or address a safety issue. Say any practitioner says they'll refer somebody and they accidentally forget. Well, a patient could say, I'll check in a couple of weeks. Oh, the referral hasn't gone through. Why is this? And there would be that extra ownership. So let's talk a little more about stories. And let's steal one. Now, this is from the Chief Medical Officer. And although you saw one of these, I think, in the last presentation, I know that was the GMS contract from 2018. Lots of good publications on that year. But realistic medicine, even it's evolved. And one of the key things, if anybody's read it, is the impact of stories. And it mentions a bit about kindness as well. We all are kind anyway, so let's not dwell too much on that. But this is a powerful story. Max wanted to remain in his local community at the end of his life, to be with his friends who were caring for him and his dog Lily. I like the personal touch about his dog, but anyway, he was an army veteran with prior experience of homelessness and trauma, and he felt trapped by institutions. Now, does that not sell something more than saying we are £7 million overspent and we need to cut back and have efficiency costs? Well, I believe it does. But the reason I've mentioned that is because I think the key that we all need to bear in mind involved in digital projects, the transformational projects and the good work that we all do is to keep that patient center. So you could say, well, what do you think? At the end of the day, I think about different things, I do my best, but then I think, just as I think the previous speaker said, would my mum be happy? Well, that's not my goal, because I'm at times naughty. However, would the patient be happy? Would the person in the middle? Why are we actually doing this? And you'll notice Sir Harry Burns on... That's actually a cup up there, and he is one of the most inspiring speakers I've ever seen, and along with the current CMO, Gregor, who's been here a few years ago. But let's think just quickly about the stories. I can tell you that the nurse there, the ANP, is holding that cup. That'll be the only thing any of you remember from this. And that's because that was actually Lockheed where I work, and Justine and I and a different GP, we all found out bizarrely we had a crush on Sir Harry Burns. And I think he retweeted that on Twitter, now X at the time. So Dr. Bina Rashkis is in the audience. And she loves this change equation. It's been modified slightly because, firstly, I've used AI to generate a cool image, and AI doesn't do text very well. It doesn't do fingers very well. It doesn't do a few things. But this is about inspiring people to change or pushing change. And the equation, does anybody know what D stands for? Give me a D. All right, dissatisfaction. You usually don't want dissatisfaction from an audience. Some of you look dissatisfied anyway, but thanks for those who don't. V is vision, and F are the first steps towards the vision. And that has to be bigger or larger than the resistance. Now, you will see this equation change depending on who's put it. Some multiply it, some add it. But at the end of the day, I think the key thing is that we need ourselves to know there's going to be that resistance, and we need to think about how to overcome that. Now, I've so far highlighted some reasons things change, and I've put a little bit about steps to transformation and the use of a story. I'm going to highlight a quote that is from the legendary management consultant Peter Drucker. Culture eats strategy for breakfast. And I do think that we have to consider that. And I have now got something very different going. And this is the interactive bit. Okay, you're going to have to bear with me. It may or may not work. But I've got sheets of paper for people. Please take a sheet, hand them on, and I'll give you a good few. Let's see, I've got, you have, thank you, thanks, Robert. Yeah, it sounds like he's done it before. Thank you. There we are. Thanks. Just pass them on. There we go. Thanks. Right, there we are. Cheers. So you've got the ability to read, and just a few moments, you're going to all start making the best paper aeroplane. Whilst you're doing that, I'll give you a story. This is good training if any of you go to Wembley, by the way. If you get the cheap tickets at the top, 4th level, you throw the paper aeroplane down. And this one landed on the pitch. You may occasionally watch live football and think, why is the audience cheering and nothing's happening? It could be a plane has landed.
The code that's being shown here isn't the code that was on your slide.
Okay, well, there you go. So, I think Dawn, I think they have different codes, but anyway. All right, I didn't give a time limit, but this thing is going to either work really well or really badly. It's all down to your skills. So there's an informal competition now. I've also got a tune I'm going to play. So my suggestion, we can do either crowd voting. There's a really, really small prize. It's called respect from your peers. But what I would do, I'd say we'll have like a row each and they throw them. I think that way, because these guys are pros at the front. I think David Cooper, he'd get a headshot. But let's have a think. So we're not going to take long. The song goes for under 3 minutes, right? It's about paper aeroplanes. And will it be loud enough? You can hear that, right? So what we're going to do, take turns, like one row just stands up and launches them. And then at the back, when we get halfway, we could switch round, yeah? Do you want to do it, or do you want me to raise the hand? There is some learning here, by the way, about why transformations fail. All right, so let's go. We're doing this now. So, like, all throw. We'll see who's the best. Oh! Who threw that one? Robin. Okay. Right. Next, let's see. Oh! Right. Here we go. Oh! Here we go. Oh! Let's go. Keep going this way, I think. And let's keep going. Let us keep going this way, easier to measure. Oh, well, there we are. Oh, he's got a dart there. Man, oh. All right. What do you think? Do you want to try and get them? Yeah, let's see. Oh. All right. Last but not least, no pressure. All right. Let's just get a quick photo. My daughter did not believe me I was going to do that. But who do we think won?
Neil Kelly.
Neil Kelly. I thought it was Neil Kelly. So he doesn't need this. What he needs is this. And I'd say Robin came second, to be honest with you. There you go. There you go. So now you all think I'm slightly crazy. But what's the learning from that? There's a lot of learning. Now, one of them I would say is that fun at work is important. Teamwork that is in a positive team is a productive team. I thought, great, I've coined this phrase. And then the Harvard Business Review beat me to it. But look, still look at that logo. Anyway, they're doing well for themselves. Did that exercise bring you joy? Well, that's good. Easily satisfied. You know what you want for Christmas, but some people it didn't. Now, it depends. We're all individuals. Some of us are more competitive than others. So, for example, you may be ultra competitive and think, I need to win this. Did the music distract you? Yeah. It did. So, you know, the pressure of were you first to throw. Now, it's important to just realize that things are different for everybody. And the same person on a different day may be in a better mood. But if we can be kind to each other, going back to the CMO vision there, and then we will work together, inspire each other more. And I did try and make a new sum up. Purpose plus passion plus persistence equals productivity. I don't know if the Harvard Business Review have beat me to that one as well. They probably have. So this wasn't just about fun at work, that exercise. This is also about blueprinting. Now, if you think about the paper, some of it was different quality. Some of you had a different technique in making the plane. Some of you had a different technique, or all of you, throwing the plane. And also, what were we going for, the best plane? Because we all assumed distance. But look at these ones. This one's pretty cool. Yeah, Neil will be making this, or Robin later. That one's a fail. This one, though, oh my, 2 sheets of paper, right? But the point is, everybody would argue, well, they wouldn't, but I would argue, this one is the coolest plane, right? A Hammerhead. Does it fly? No. David, he was going to get me with the headshot, and there's karma. So if you wanted to think about something, you'd think, what is the distance? And there is a website called Fold and Fly. I didn't have time to make this beautiful, easy-to-follow paper aeroplane. But what I did do is have time to look at NHS England's blueprinting instructions. Now, the other thing I would just go back to those paper aeroplanes is that why would you want to blueprint? Well, it's because what we would do, we'd say, okay, Neil, we can't replicate how wonderful you are, but we can steal your idea for how to make that paper aeroplane. And you can maybe give us a bit of a pointer about the throw-in technique, and that would help. And that's what in clusters we're often trying to do, GP clusters. I think I would have to, however, I can't help but quote Dr. Paul Miller here, that if we share and compare, somebody will go home red-faced. But the other thing we didn't do is have a tape measure, or a way of accurately measuring these throws. So it's all by eye. So blueprinting, well, this captures a digital transformation process, and it is a way for peer-to-peer learning to occur. And in England, they did at one point have GDEs, which lots of money was injected into certain trusts, and other trusts, then they would try something, they would try and pioneer this, say what works, and other people could copy it. I don't think the project worked too well. GDEs is an old acronym now. But blueprinting has many, many benefits, and potentially it can accelerate the delivery of digital technology transformation, support better patient experience, and it can also reduce the risks of lessons learnt in terms of failures. And we all want to accelerate success through digital transformation, or we probably do. If not, you've come to the wrong conference. But we want to inspire, guide others, and blueprinting's the thing to look up, a great concept. Now, a little bit more about fun at work. How could I not mention this particular thing? Come on. So, obviously, SNOMED's important. SNOMED is where we're all going. And it contains 19 domains arranged in polyhierarchical structure, which is organized in concepts linked together through an is-a relationship. And you can have more than one parent. Why is that relating to the paper aeroplanes? Anybody guess, other than the slide that says aircraft device? And there's a code for a glider as well. Well, did anybody notice that the music had the words paper planes? Yeah, they did. So these are people who like auditory things. Whereas I've been referring to them as paper aeroplanes throughout. Now, it's the same thing. Nobody is going to argue about that. But I think, particularly with interoperability, digital health, it would be amiss to not mention the importance of having the correct terminology and making sure that the meaning of something doesn't get lost when things migrate. If you do find SNOMED CT fun at work, then, NSS, I'm sure, will be delighted to hear from you. So the other thing about fun at work, I personally enjoy learning and empowerment. And basically, what can we do to encourage personal growth in others, in ourselves, in our team members? And it's by actually delegating often authority to individuals that leaders can build that trust and accountability. And a lot of this will relate to job satisfaction, which is clearly tied to recruitment, retention, and you can boost morale. I'd mention another quick story from a lovely book, The Dichotomy of Leadership, in which this is based in the army, and some of the soldiers were told, or they're all told, you can't wear your personal logo, so ultimately if you get killed, you're not identified. But then they saw a promotion video with a news reporter going round, and lots of them were wearing this. And the leader had this dilemma. Do I come down hard on them, or do I not? And I think this is down to leadership capital. And he decided not to, and it gained respect, because that's not the most important rule in life. But when it came down to something that was important, people listened to him, because he spent his leadership capital wisely. Emotional intelligence, a great concept, overlaps with emotional sensitivity. But this is key in leadership. Firstly, you need to lead yourself before you can lead others. I'm sure many people have said that before. But in essence, you're thinking about the impact that you can have on other people. Now, I know it's often we think, I can't do anything, you have days of doubt. But if you bring your best self to work, and often that's with a positive, productive team, then you can really inspire others to work to their best. Now, I said I'd mention a bit about leadership styles, adaptive leadership. From personal experience, this is how not to get a job if you're asked in a job interview. What's your leadership style? Adaptive leadership. Okay, the other candidate was better. Things work out. But adaptive leadership is more of a mindset, it's a way of thinking, and it's a way that leaders can thrive in uncertain times. And if your particular method isn't yielding results that you're keen for, you can try a different way, and that's where the adaptation comes in. So visionary leadership. I did mention about why transformations fail. And visionary leadership seems fairly straightforward. But it's not just about developing a compelling vision. It's about sustaining one that motivates and unites the team. And by effectively communicating a vision, that's how people can inspire others. Ethical leadership. Now, this is critical. And you think, but what is ethical leadership? Well, if you want to spend some time, the documents I would study are GDPR. I'd also consider signing up to the ICO website. But in essence, the key about ethical leadership in digital health is that we can lose trust very easily if we don't hold data to high standards. And we need to make sure that patient trust is maintained. That's of paramount importance. So if we can foster an environment of accountability and also transparency, that's how we can actually manage ethical leadership, because I guarantee you all of these cybersecurity attacks, hacks, data loss, that is extremely damaging to trust. The next one is servant leadership. Anybody familiar with this? This emphasizes the prioritizing of the needs and well-being of the team above the leader. Now, leaders can do this with empathy, humility, and it's about trying to get everybody in that team to work to their full potential. Now, it's that approach that not only fosters loyalty, but it can drive overall organizational success. Now, many of us know AI can't do empathy. It also can't do servant leadership, because this diagram or this image is completely wrong. You don't have the servant leader being held up. This isn't the Messiah. This should be the other way round, with the leader holding up others. I also didn't put, please give me an image based on servant leadership in Scotland, because that workforce look incredibly heavy, light on the scale of things. Their BMI all flawless. Now, there's one more exercise for you all. And this is a bit about thinking. What type of leader are you? Now, we would want to appreciate that the purpose behind this is to appreciate a bit about ourselves and a bit about other people, because we're all different, as I've alluded to. You don't need me to tell you that. But this is another brief thing. Hopefully I'll get you to all stretch your legs briefly. No paper aeroplanes involved. Now, you may have heard about this as a leadership compass. Again, a bit like the change equation. It's been changed, sabotaged to whatever the person wants to have a slightly different compass to put on their website. But there's 4 aspects of leader style. And one would be, it's called North, the closer, the deal closer, decisive, assertive, focused on the outcome. And at times these people are thought of as, they don't really care about me much, because they're polar opposite to the South, which is the nurturer, supportive, caring, focused on the process. And then we've got the West, analytical, thorough, practical, focused on the details. And the East, this visionary leader, in which you create an innovative way, and you're focused on the options and the opportunities that are there. So, as I say, the key here is that we all have our own strengths, and the one thing I'll just point out is that you may listen to this and think, I'm all of those. I'm just brilliant about everything. But you may think, look, I've got a bit of this and a bit of that. That's fine. It's not that it's a thing that you go this way and that's you forever. But what I thought would be a good idea, as we've got about 5 minutes left, is if we all get up and walk to where we think we are. So I'll put at the back the North team. So this would be kind of just in front of that, let's say to the side of the camera, not to block out the whole view, like the back row. So these are people, if you don't all have to rush at once, but I thought I'd choose North first because you're decisive, assertive. So if you think your leadership style is that way, decisive, assertive, please go up to the back of the room. If you think that you're a South side, which is a nurturer, supportive, caring, then please come up just around the stage. You can come up on the stage if you want to feel like you're masquerading as a North for a change. We'll have the East over there, and this is visionary, and the West over there, the analytical ones. And there is no judgment. You can lie. It would only be to yourself. But let's just have a little walk, see where we think we are. We're tying up soon. Yeah, so it's north, closer, the decisive north, the people person, south, visionary east, analytical west. Whoops.
Where do we go for MP3?
So the north is there, yeah? The assertive people. Okay. Just going to take a picture of this. So take a look around. See where your colleagues are. See where you put yourself. Look, Alex is north. So you can all go back to your seats. But So I personally found that fascinating, but that's because I'm an analytical Westie. But I genuinely think that gives you the opportunity to think, appreciate your perhaps strengths and other people's strengths. A quick story in my practice in Lockheed, the previous chap, he's lovely, he's retired now, I am not going to name him. There were some ideas we had about improving practice, and he would say, like, oh yeah, we'll get the GPs to answer the phones so receptionists can have a break, and then that way it'll boost the morale of the practice. And I'm sitting there thinking, this guy's mad. But we did the same exercise, and then we did that, and I walked to the analytical side, he walked to the visionary side, and we looked at each other, and our penny dropped. And after that, we worked really, really well together. Different persons come to the team, I can notice their north tendencies, that's absolutely fine. They're doing this to drive patient care, and I know that to me, that genuinely was a powerful experience, but I'm astounded by my poor instructions and nobody going to the north there. So we are going to close up now. You'll be delighted to hear. I think I have the opportunity to shamelessly plug my website. Did I mention that I summarize books and put them on my free website? And I've also got a monthly newsletter, and I would shamelessly plug that. But look at the timing. 44 minutes, 25 seconds. It is not me who's keeping you from coffee. So half an hour really just to say thank you. And I genuinely have been fortunate in my career to have met so many inspiring people. They've helped me along the way. It really means a lot. I think that we should inspire each other, help each other, and I genuinely would like to just take these last 10 seconds to say thank you all so much for being here, and I hope you have a fantastic day at the conference. Thank you.